Healthcare is marking the MLK Day holiday, paying tribute to the life and legacy of Dr. King. Joining us today to talk about Dr. King's impact and what this day means for healthcare is the Vice President of Community Health and Engagement at Hartford Healthcare, Greg Jones. Greg, thank you for being with us today. We appreciate it.
Thank you for having me.
All right,
My pleasure.
You appreciate it. How does Hartford Healthcare honor MLK Day?
Well, we're reminded that Dr. King in 1966 at a medical commission on human rights said of all inequalities, injustices in health is the most inhumane and shocking. So with that, we live out community engagement and improvement in health every day. We understand that today is a day to recharge and recommit, but it is really more than just one day. So our mission at Hartford Healthcare is to use this day to recharge and recommit to address the inequalities that Dr. King spoke about back in 1966.
Why is it so important for healthcare workers to take time to observe this day?
It's important for us to observe this day because we are at the forefront of changing what I think outcomes and lives of folks. We are at the forefront addressing some of the root causes of the issues that we face in health, those social influences of health, whether it be income, jobs, education, food, nutrition. So it's important that we are like the frontline workers, or my colleagues, I should say, like the frontline workers are out addressing these issues so that folks can have a healthier lifestyle. With health comes good living.
Hartford Healthcare focuses a lot on community outreach. Talk to us about that.
Certainly, and this is how we build and honor Dr. King's legacy. A number of our programs address these issues that he spoke about, inequalities. We have a Food for Health Nutrition Center on the Hartford Hospital campus that provides healthy produce for the underserved market. Nutrition is a key focus for us. We have partnered with the Brother Call Institute with our Institute of Living to provide mental wellness and training for folks to get down to the root causes of gun violence. We have a Healthy Brain Initiative for Black and African Americans that started by Dr. Tony DeMarcade and the folks at the Iron Neurosciences Center so that we can understand the issues related to movement disorders and how they affect African Americans. Knowledge is one of the key aspects of access, and that's what we're trying to do among other programs at Hartford Healthcare.
We've got about a half minute left. What are some of the goals to continue bringing access to care to the community?
Certainly, to continue digging deep into what these root causes and the social determinants are, the social influences. We'll continue to have programs. We started a program about maternal health with our new Maternal Health Equity Initiative. We've got an Ann Jennings Vicey Brooks Fellowship that addresses recruitment for African American and Latino nurses. We have our Neighborhood Health Initiatives been ongoing to reach directly into communities to provide health. We like to think of less talk, more doing, and we can address some of the issues that Dr. King spoke about in 1966.
Greg Jones, Vice President, Community Health and Engagement with Hartford Healthcare. Appreciate your time. Have a good rest of your MLK Day.
Thank you as well.